Now that your little one has arrived, you may have 100 questions about how to care for him. This video will help you learn what to do from head to toe. Let's start with his skin. Many babies will develop a newborn rash, which has a red pimply appearance. You don't have to do anything to treat this, as it will go away on its own. Jaundice is also fairly common and generally reaches its peak 36 hours after birth. However, if you notice a yellowing of the skin or in the whites of the eyes, you'll want to call your pediatrician. Another common condition with newborns is increased mucus. This may require gentle suctioning using a bulb. Simply hold your baby on his side, squeeze the bulb, place it in the corner of his mouth, and then release the bulb. You don't want to push the bulb too far into your baby's mouth because that can cause a gag reflex. If your baby's nose is stuffy, you may need to suction that as well. The excess mucus should subside within a few days. Next, let's talk about your baby's umbilical cord. The main rule of thumb here is to keep the cord clean and dry. Sponge baths are recommended until the cord falls off on its own, which can occur anywhere between a few days and a few weeks. You will be changing a lot of diapers over the next few years, so let's talk about that next. Most babies want to be kept warm, so they may cry as soon as you begin to remove their clothes. If you get everything ready in advance, diaper changes will go much faster and easier. Safety is always the #1 rule, so be sure to keep your baby secure at all times. Remember to always wipe your baby from front to back. Unless your pediatrician specifically recommends it, there's no need to use powder. Slip the new diaper under your baby and fasten securely. Check that you have room to insert 1 or 2 fingers so that you know the diaper isn't too tight. You'll want to roll down the top of the diaper so that it doesn't irritate or hamper the healing of your baby's umbilical cord. The best way to avoid diaper rash is to keep your baby clean and dry. One thing you should know about those color-changing strips on diapers is that they do a good job of letting you know if your baby is wet, but they don't always let you know about bowel movements. By the time your baby is about 5 days old, you can expect roughly 6 wet diapers a day and 3 to 5 bowel movements. So again, plan on frequent diaper changes to keep your baby clean and dry. If a diaper rash does develop, we recommend using A&D ointment or Decidin. Now let's talk about circumcision care. There are 2 types of circumcision. For baby boys with the plastibell, the penis can be washed, but no ointment should be used. There's no need to pull on the ring, as it will fall off on its own within 7 days. If your son had a Mogan or Gomco circumcision, you will want to put A&D ointment on a fresh gauze pad and place that over the penis at each diaper change. This will prevent the penis from sticking to the diaper and therefore aid in the healing process. Since sleeping will be a major part of your infant's day, and hopefully night too, let's go over a few do's and don'ts for that. Swaddle your baby for comfort and warmth, and place your baby on his back in the crib. Don't place anything else in the crib. No stuffed animals, bumper pads, extra blankets, pillows, etc. And don't let your baby sleep in your bed. Not only is this a bad habit that you'll later regret, but it is also quite dangerous. If all goes well, your baby will be generally healthy and happy. If, however, you're worried that your baby may be sick, you can take his temperature quite easily. Place the thermometer in the middle of your baby's armpit and hold his arm to his side until the thermometer goes off. Normal temperature is 97.7 to 99.6. If your baby's temperature is 100.4 or higher, it's time to call your pediatrician. So those are the basics. Baby care from head to toe. If it seems a little overwhelming at first, don't worry. It will all become second nature to you in no time, and you'll soon be caring for your baby like an old pro.